So I'm not going to say much about OBRA 81. Like other programs, it consolidated 7 programs into one block grant, and among those were the children with special health care needs programs, genetic programs, and hemophilia. They were consolidated in much the same way as the other programs in the MCH block grant. So there really wasn't a catering to or a specific consideration of those groups. But when OBRA 89 came along, I don't know that I would call it catering to the population, but there was a very clear intention to ensure that children with special health care needs would be intentionally included and supported as part of the broader MCH population, and as a separate population needing services over and beyond what typically developing children needed. So, after all, the goal of MCH is to improve health care for all mothers and children, including children with special health care needs. So the point I want to make is that children with special health care needs are not just represented by the 30% designation. They are included not only in that 30%, but they are included in the 30% and the rest of the provisions of the MCH block grant. For example, children with special health care needs are included in that provision for primary and preventive care. They are included in the provisions for access to EPSDT. They are included in the drive to increase immunizations among all children. So we're really looking at children with special health care needs as all part of all children, and therefore entitled to all the 100% of the block grant, with 30% designated specifically to meet the unique needs of that population of children with special health care needs. That's not to say that 30% wasn't really significant. There have been earmarks for crippled children and children with special health care needs before, but in OBRA 89, that 30% was front and center, and Title V was accountable for making sure that that 30% was spent on the unique needs of children and youth with special health care needs. With that said, there was also the provision for the special projects of regional and national significance. And I have to say that program has been very instrumental in helping to develop the concept of systems of care and definition of children with special health care needs, and the National Survey of Children with Special Health Care Needs, which is now incorporated into the National Survey of Children's Health. Again, not catering to children with special health care needs, but I have to say OBRA 89 really provided a robust framework to enhance the role of Title V in building comprehensive systems for this population of children and their families, both at the national and at the state level. And then, as I think I mentioned before, it provided some very specific accountability by way of the needs assessment, the annual report, and the application